my name is Mike, and for my EMS how-to presentation I have chosen dopamine. Indications for dopamine are hypoperfusion due to myocardial infarction, sepsis, severe congestive heart failure, pulmonary edema, and cardiogenic shock. Contraindications for dopamine are VFib and VTAC. Adverse reactions, ectopy, localized tissue necrosis at the IV site if you have IV infiltration, tachycardia, palpitations, dysrhythmias, hypotension, nausea, and vomiting. Precautions. You want to correct any volume deficit prior to instituting a dopamine therapy, and you want to avoid mixing sodium bicarb and dopamine in the same IV line as it deactivates dopamine. Adult and pediatric doses are as follows. You will start at a dose between 2 and 20 micrograms per kilogram per minute. Most agencies will start at a dose of 5 micrograms per kilogram per minute. Dopamine is supplied either as a pre-mixed, pre-filled bag, yielding you a 1600 mics per milliliter concentration, or as with my agency, we have 10 ml vials of dopamine, giving you 40 milligrams per ml, or a total of 400 milligrams per vial. You need to mix that in a 250 ml bag. The way to do that, you will need a 10 ml syringe, a needle, and an alcohol prep. You will pop the top, swipe the top with the alcohol, draw up the entire contents, or 10 mLs. You will then open the IV bag, clean the top with alcohol, stick the needle in, and inject the entire contents, or 10 mLs, into your 250 ml bag of fluid. That will yield you a 1600 microgram per milliliter solution or concentration. You then want to insert your IV tubing and flush the line. There's a variety of different methods to use for giving dopamine, and I'm going to show you the clock method. So as you can see here, on this side you'll have the orange circle representing time in seconds, 15, 30, 45, and 60. The time will also be corresponding with the dose. So if you're giving 15 drops, or 15 seconds, you'll be giving 15 drops. 30 seconds, you're giving 30 drops. 45, you'll be giving 40 drops. And 60, you'll be giving 60 drops. In addition, on the green outside circle, you'll note how much medication you're actually giving. So on this side, you'll see that it's 400 micrograms, 800 micrograms, 1200 micrograms, and 1600 micrograms. So you can see up here, if you have an 80 kilogram patient, or the patient who weighs 176 pounds, and you start with a 5 microgram per milliliter concentration, you're going to give a starting dose of 400 mics per kilogram per minute. You'll move over there and you'll note that you're going to start at 15 drops a minute. The other way to do it would take the patient's weight. So if you have a 176 pounds or 80 kilogram patient, you subtract the last number. So 176, subtract the last number, so now you have 17, then you subtract 2, giving you 15 drops, or 400 micrograms a minute. That's my dopamine in a nutshell. Thank you.